If someone pressed down on your fingernail right now until it turned white, then let go, how many seconds would it take for the pink color to come back? Most people have never timed it, never thought to, and have no idea that this 30-second test is something emergency rooms and vascular specialists use every single day to check exactly how well blood is reaching the far edges of your body. Fewer still know that a slow answer to that simple question is tied to a specific, well-documented increase in heart attack risk, not because your nail itself is unhealthy, but because of what a slow answer says about the arteries running underneath it. Consider a man in his early 60s, call him Robert, the kind of case this pattern shows up in again and again. Robert had noticed, almost as an afterthought, that his toenails had started growing more slowly than they used to, and that his feet seemed to run colder than the rest of him, especially in the evenings. Nothing painful, nothing that interrupted his day. He mentioned it to his doctor, almost in passing, expecting to be told it was simply a normal part of getting older. Instead, his doctor pressed on his toenail, watched the color return, and didn't like what she saw. A follow-up test confirmed reduced blood flow in the arteries of his legs, and that same finding became the reason his doctor caught significant narrowing in the arteries feeding his heart months before it had any chance to cause a heart attack. What makes Robert's case worth sitting with is exactly how easy it would have been to never mention it at all. Slower toenail growth and slightly cold feet are the kind of small, forgettable details most people either don't notice or simply chalk up to getting older, the same way they might shrug off needing an extra blanket at night. Nobody in his life would have connected that detail to his heart specifically. That's the entire point of this video. The connection is real, it is well documented, and almost nobody has ever had it explained to them in plain language. A quick note before we go further. This channel is for general education, not medical advice, and I am not your doctor. Nothing here is a diagnosis or a prescription. Always talk with your own doctor about any new symptoms or concerns about your circulation or your heart. With that said, let me walk you through exactly what this fingernail sign is, why it connects so directly to heart attack risk, and how to check for it yourself in under a minute. Here is a distinction almost nobody explains, and it's the one that makes everything else make sense. Your fingernails and toenails sit at the absolute end of your circulatory system, the very last stop the blood reaches after traveling from your heart through your largest arteries, down through progressively smaller vessels, and finally into the tiny capillaries just beneath your nail bed. Because that delivery route is so long, the nail bed acts almost like a canary in a coal mine for your entire arterial system. If the arteries somewhere along that route, anywhere from your heart down to your fingertips and toes, have started narrowing from plaque buildup, the nail bed is often one of the first places that shows it simply because it's furthest from the pump and most sensitive to any drop in delivery pressure. Doctors test this directly using something called the capillary refill test or the nail blanch test. Press firmly on the nail until it turns white, release, and count how long it takes for the pink color to fully return. In a healthy, younger, or middle-aged adult, that should happen in under 2 seconds. In adults over 65, research measuring this in healthy volunteers found the normal upper limit runs a bit longer, up to around 4 to 4.5 seconds, simply because circulation naturally slows somewhat. With age and skin temperature, lighting, and even time of day can shift the results slightly. The number that matters isn't a single fixed cutoff. It's whether your refill time is taking noticeably longer than that, adjusted range, or longer on one hand or foot compared to the other, or getting slower over months when you check it the same way each time. Let's walk through what a slow answer to that test can actually mean. Because just like with Robert, this rarely announces itself as anything dramatic. The first thing worth understanding is what's actually happening in the artery when refill slows down. When narrowing develops in the arteries supplying your limbs, a condition called peripheral artery disease, or pad blood, simply has a harder time getting all the way out to your fingertips and toes against the same pressure it used to. That shows up as a slower color return after blanching, and it can also show up as nails that look paler or slightly bluish compared to the surrounding skin, and has nail growth that is visibly slowed, particularly on the toes. None of these signs hurts. None of them stops you from going about your day. That's exactly what makes PAD one of the more dangerous, quiet conditions in cardiovascular medicine. By the time it causes pain, cramping, or wounds that won't heal, the underlying artery narrowing has often been progressing for years. Already, the second thing, and this is the part that connects a leg or finger finding directly to your heart, is that peripheral artery disease is almost never an isolated problem confined to your limbs. PAD develops through the exact same process as coronary artery disease, atherosclerosis, the gradual buildup of fatty plaque inside artery walls. If that process has progressed far enough in the arteries, is running to your hands and feet to slow your capillary refill or change your nail color, there is a very real chance the same plaque building process has been quietly happening in the arteries feeding your heart. At the same time, this is not a loose association. Research tracking patients with confirmed peripheral artery disease has found they face somewhere between 10 and 15 times the risk of major cardiovascular events, heart attack, stroke, and related complications compared with the general population. A separate analysis from a major heart research institute puts it even more directly. People with PAD are up to 6 times more likely to have a heart attack or stroke than people without it. Beyond the numbers, doctors who specialize in vascular disease describe PAD essentially as a visible preview of what's happening elsewhere in the arterial system, because narrowing rarely confines itself to a single set of vessels. If the arteries are diseased enough in one region to produce a measurable symptom, the underlying process driving that narrowing has almost always had years to work on the arteries everywhere else too, including the ones your heart depends on every second of every day. The leg or fingertip symptom is rarely the real story. It's a visible flag for a process that is very likely also unfolding invisibly around your heart. The third thing worth knowing is what makes this sign genuinely silent in the way the title promises. And it's the same reason Robert's case is worth remembering. Peripheral artery disease frequently produces no leg pain at all in its early stages. Researchers and vascular specialists have long noted that a substantial share of people with measurable PAD report no classic symptoms whatsoever, meaning the disease can be quietly present and quietly progressing for years before someone ever feels anything that would prompt a doctor's visit. The classic symptom most people associate with PAD, cramping in the calf during walking that eases with rest, simply never shows up for a large portion of people who have the disease, which means waiting for pain is, for many people, waiting for a symptom that may never arrive until something more serious already has, the nail bed, precisely because it's the most distant, most pressure-sensitive point in the entire circulatory system, can show a subtle change well before pain, cramping, or other classic warning signs ever show up. That is exactly why a 30-second test at home, performed occasionally and compared against your own baseline, has genuine value, not as a replacement for medical care, but as an early flag worth bringing to a doctor's attention before symptoms force the issue. The fourth thing is the honest caveat, and it matters as much as everything above it. A slow capillary refill or pale, slow-growing nails are not on their own proof of heart disease. Plenty of things can slow this test down that have nothing to do with your arteries, cold hands or feet at the moment of testing, certain blood pressure or migraine medications, low blood pressure from dehydration, anemia, or a separate and far more common condition called Raynaud's phenomenon, where small blood vessels in the fingers temporarily overreact to cold or stress and can slow refill dramatically without any underlying artery disease at all. Even something as simple as the room being a little cool or testing your hands right after walking in from outside can shift the result by a second or more. This is precisely why doctors don't diagnose PAD or heart disease from a nail test alone. They use it as one data point that, combined with a leg blood pressure comparison called an ankle brachial index and a fuller history, builds a real picture rather than a guess based on one observation. The honest version of this sign is not slow nails, mean. you're having a heart attack. It's a consistently slow, asymmetric, or worsening refill time, checked the same way more than once, is worth a conversation with your doctor, particularly after 60, when both pad and coronary disease becomes substantially more common. The fifth thing worth a brief mention, since we're already talking about what your nails can reveal, is that this particular sign has company. Doctors also watch for thin, reddish-brown streaks running the length of the nail, called splinter hemorrhages, which can signal an infection of the heart's inner lining called endocarditis. And for nails that turn mostly white, with only a narrow pink-brown band near the tip, called Terry's nails, which is associated with congestive heart failure, among other chronic conditions. There's also nail clubbing, where the fingertips widen and the nails curve downward like an upside-down spoon, classically checked with a simple at-home test where you press two matching fingertips together, nail to nail, and look for a small, diamond-shaped gap. Its absence is the sign doctors are trained to look for, and it's associated with chronic heart and lung conditions, though it tends to develop over a much longer and slower timeline than the Blanche test we focus on tonight. All three are real, all three are worth knowing, and all three deserve their own full explanation another time. But none of them is as quietly accessible as the Blanche test, and none connects as directly through a shared and well-documented disease process to your actual heart attack risk the way peripheral artery disease does. Here is where I need to draw a hard line, because this is exactly the kind of topic where fear can do real damage if I leave it unclear. Noticing a slightly slow capillary refill one time on a cold day in a cold room is not an emergency, and it is not a reason to panic. The line between a nuisance and something worth a doctor's visit is consistency and asymmetry. And nuisance is one slow reading on a cold morning that returns to normal once you've warmed up. Something worth bringing to your doctor is a refill time that stays slow across multiple checks at room temperature, especially if one hand or foot is consistently slower than the other, or if it's paired with cooler skin temperature, visibly paler or bluish nail color, or noticeably slowed nail growth over several months. None of that is an emergency requiring a same-day call. It is, however, worth describing specifically at your next regular appointment because it is exactly the kind of finding that an ankle brachial index test can confirm or rule out in a single office visit. The one version of this that does warrant faster attention is if a slow refill or color change appears suddenly in a single limb alongside new pain, numbness, or a noticeably cold extremity that wasn't cold before. That combination can signal an acute blockage rather than the slow, gradual process we've spent most of this video describing, and that combination is worth a same-day call rather than waiting for a routine visit. So what does the safe version of this actually look like? It starts with simply knowing your own baseline. Press on a fingernail with the opposite thumb until it turns fully white. Release, and count the seconds until the pink returns. Try it on a finger of each hand under similar conditions, ideally indoors at a normal room temperature, not right after coming in from the cold. Do it again on a different day at a similar temperature, since a single reading tells you very little on its own. If you consistently land within a couple of seconds and it's roughly even between ands, that's reassuring information on its own. If you notice it creeping slower over time, or one side consistently lagging behind the other, write down what you're observing, which finger, which conditions, roughly how many seconds, and bring that description to your doctor rather than waiting for it to become painful. And the same logic applies to your toenails. If you've noticed they're growing noticeably more slowly than they used to, or your feet run colder than the rest of your body more often than not, and those are worth mentioning in the same conversation. This is especially worth doing if you're over 60, since that's when both peripheral artery disease and coronary artery disease become significantly more common, and when catching either one early genuinely changes the conversation about prevention rather than treatment. After the fact, I want to be just as clear about what not to do. Do not use a single blanch test. Perform once as a reason to assume you're heading toward a heart attack, and do not skip an actual medical evaluation because home checks seem fine. This sign is a flag worth raising, not a diagnosis you can make on your own kitchen table. The safe action is always the same. Describe what you've noticed as specifically as you can to your doctor, and let an ankle brachial index or a broader cardiovascular workup do the actual confirming. Here is the doctrine I want you to walk away with, because it applies well beyond this one sign. Your body rarely announces serious arterial disease with a dramatic single moment. It tends to leave small, quiet, peripheral clues first, in your nails, in your skin temperature, in how quickly color returns after a simple press, precisely because the places furthest from your heart are the first to feel a slowdown in delivery. Learning to notice those quiet clues and treating them as information worth a conversation rather than either a guaranteed diagnosis or something to dismiss is exactly the kind of awareness that turns a silent process into a treatable one. This is also why I'd encourage you not to think of this single test as a one-time pass or fail check, but as something worth folding into how you pay attention to your own body over time, much the way you might notice if your energy or your stamina has shifted gradually. The value isn't in any single reading, it's in noticing a genuine, sustained change from where you started. To recap what's worth carrying out of this video tonight, first, the capillary refill test is a real simple way to check how well blood is reaching the far edges of your body, and a normal result generally falls under about 2 seconds in healthy adults, with somewhat more allowance after 65. Second, a slow, consistent, or asymmetric result can reflect peripheral artery disease, which shares its underlying cause with coronary artery disease. Third, that shared cause is exactly why PAD carries a dramatically higher risk of heart attack and stroke. Research puts the increase at roughly 6 to 15 times, depending on the study. Fourth, PAD is frequently painless in its early stages, which is precisely what makes a quiet nail bed sign so valuable to know about. And fifth, the right response to a slow or changing result is a specific conversation with your doctor and a proper test, not panic and not dismissal. Before you go, try the test on yourself tonight and tell me in the comments how many seconds it took for the color to return. I read these and it helps me know what to dig into next for people in your exact situation. And if this explains something you'd never had explained to you before, there's another habit nearly as quiet as this one, working against people after 60. A common vitamin that, taken the wrong way, can put a silent strain on your kidneys. That's the one I'd watch next.